I have the unenviable position of being after lunch, and I know everybody always says it's bad to be before the audience and their lunch, but being after also has its problem because now you're relaxed and you're ready to have your post-lunch nap, so I apologize for that. But we're ready to start the afternoon session, which is entitled Future Directions for Canada. I'm Diane Finegood. I'm the President and CEO of the Michael Smith Foundation for Health Research, and I'm also serving as the co-chair of the National Alliance of Provincial Health Research Organizations, so hence the two logos there. So I'm going to give a couple of slides to kind of try to tie together this morning and lead us to thinking about the future of future directions for Canada as it relates to commercialization and innovation. And anybody who knows me knows that I always start with this slide, and I always say that I like it because you can't read it because it's actually an obesity system map, but I just can relabel it because you can't read it, and it really conveys the notion that a starting place here is that we're working in a complex environment. The innovation system is complex, the health system is complex, and many of other systems that touch upon the conversation we're having here today is complex. Commercialization is a complex business, and you've heard a lot about that already. And what's important to remember is that there are differences between simple and complicated systems and complex systems. And this is just a list of the characteristics, and one of my tweets earlier today was around the heterogeneity of this issue around of the private sector around commercialization. When we're talking about commercialization of drugs versus something like med tech, I think the situation is actually quite different, and it seemed very clear to me that we have to be recognizing this heterogeneity if we're going to develop good ecosystems for these different kinds of private sector activities. So we have to keep these things in mind and recognize that when you have a complex system, the responses tend to be things like retreat, despair, believing the problems beyond hope, assigning blame, simple solutions, but occasionally we galvanize our collective efforts to and invest significant resources. And it's important to recognize that our initial tendency is to react badly when we want to admit it's complex, but let's not hide our head in the sand. Let's recognize what we're talking about is complex, and then look for solutions that are appropriate for complex problems. And so I've been working in this area for a number of years and collected up my own personal list of solutions that complex systems thinking and complex systems approaches suggest are more appropriate. The theory tells us this is more appropriate. And the first one will be enormously challenging to most people in this audience, that statement that a reductionist paradigm is not that helpful. Because we've all been trained to think if we figure out how A leads to B leads to C, then we'll know if C is a problem, we'll go back to A or B as in seeking solutions. But when you've got that big mess of interdependencies and nonlinearities and random behavior and emergent behavior, it actually isn't all that helpful to do this. You not only spend a lot of time looking for the cause of a problem without really finding it or only finding it in very constrained ways, but you also lose track of solutions that will actually work. So I don't have time to go through this whole list, but I bring it up and I've highlighted some that we've already heard about today, and we're actually going to hear a bit more about this afternoon as it relates to things like, you know, when a system's big and complex like that, actually individuals really matter. The individual companies matter, the individual patients matter, the individual families matter. We heard that from Pat McGrath. And what's important is to think about how you can match an individual's capacity to the complexity of their particular task. And so you heard from Pat about how they're wrapping services around families to make it easier for them and decreasing the complexity of addressing the challenge of youth mental health. So we've heard some good examples of that. We know we need to assess the effectiveness of what we do. We've talked about interdisciplinary teams and interdisciplinary teams, a core principle there is building authentic trust. So these are important things we've heard about. I also think as a funder, we have to think about some other things. We have to think about how we can create incentive. We already know about competition as a means for engendering cooperation. We were talking about that earlier. And we have to learn how to move away from letting something happen or making it happen to helping it happen. So these are various kinds of strategies, and these may provide you some things to think about as you go forward. So to introduce this afternoon's session, we're going to hear about personalized medicine in the context of a patient-centered approach, and this will tell us a little bit more about why patients matter and how we need to really address capacity and complexity. And then we're going to hear about assessing effectiveness. And traditionally, Catherine will tell us about the need to report on impact of research and all the work that Canada's done, an extensive amount done in true leader as it relates to addressing the ROI of health research. But I would also contend that given that the problems are more complex and the approaches need to be appropriate for complex problems, that there's a whole bunch of other kinds of measurements that we need to be thinking about. We need to think about this shift away from a reductionist paradigm and attribution of cause and effect to measurements that will help us adapt in real time to different contexts. Because if we want to scale up and spread anything we do, context matters, and that becomes quite important. We need to think about different kinds of measurement systems, and these are often referred to as shared measurement systems. We need to focus on system parameters and not necessarily just targets and outcomes, because if you have a target of reducing childhood obesity by 5% by such and such a date, and you don't reach it, you don't know why you didn't reach it. And if you did reach it, you don't know why you reached it. So let's focus on the system parameters that help you understand how to act in real time and continuously improve. And the last line there about acting locally, connecting regionally, and learning globally is my message to the rest of the audience that we really need to strengthen provincial and national efforts and our collaborative relationships between what we do in the provinces and the provincial health research organizations and what goes on nationally. So this is kind of the way of the future. Collaboration is important, trust is important, individuals matter, and I'm going to introduce our first speakers. We have two speakers in the first part around personalized medicine, Sarah Ahmed and Susan Bartlett.